Celiac disease. This is one of the most debated, discussed topics in the current era, and also one of the topics which is most searched in the Google search engine for possible symptoms and solutions. So what is celiac disease? Celiac disease is basically an autoimmune disease which has a majority of its symptoms confined to gastrointestinal tract or the GIT, and it also has extra GI symptoms which may be related to other organ systems. So why is celiac disease so important is because the prevalence has increased to 7.5 to 8% every year from the past decade or so, and 80% of the celiac disease cases go undiagnosed, which is worrisome because if not diagnosed and treated, it can lead to a lot of complications. And there is also a meta-analysis which actually pointed to the fact that if celiac disease is not diagnosed and treated, it can increase the mortality rate or the death rate to a very great extent. So it's very important that we know what is celiac disease, get it diagnosed and treated early. Celiac disease is basically an autoimmune disease. There can be many factors which result in celiac disease. One of the most important factors that I would say is very important to know is genetic predisposition. So if you have genes which predispose your body to celiac disease, then most probably you will have it. Second most influencing factor is environmental considerations. For example, what kind of food habits you currently have, your lifestyle factors, your stress levels, whether you were breastfed or not, and apart from this there are many other factors. For example, whether your immune tolerance to gluten, especially in the intestinal mucosa, is appropriate or not, whether you have antibodies which act against gluten or gliadin. These factors play a very important role, and also whether you have a sensitivity to gluten or similar peptides, or whether you have intestinal tight junctions appropriate, or whether there is a leaky gut, and your gut microbiome, whether you have the appropriate type and amount of probiotic colonies or the beneficial bacteria, or whether you have a dysbiotic flora. These factors are going to be the prime things which determine whether you get celiac disease or at least the symptoms of celiac disease or not. Whether I have celiac disease or not, you can only know through proper testing. That can include a wide range of genetic tests, including testing for tissue transglutaminase and endomysial antibodies, comprehensive stool testing for dysbiotic flora, or maybe even the presence of inflammatory markers in the stool, or even intestinal permeability. These tests will help us know whether you have celiac or not. It's going to be supportive. Apart from knowing through an objective parameter like testing, we also should have certain subjective symptoms which are hallmarks of celiac disease. So what are those? First of all, it includes GI based symptoms, which are basically gastrointestinal manifestations, which can include diarrhea, malabsorption, steatorrhea, unable to absorb fats, or maybe greasy fatty stools, increase in the frequency of stools which are not properly formed. It can also lead to certain other symptoms like reduced bone mineral density, chronic fatigue, failure to thrive, loss of weight, or the inability to gain weight in spite of a good nutrition, and many other neurological and psychological manifestations in the long run if they are not addressed. It is also speculated that if not treated, these symptoms or these causes which also result in celiac disease will probably result in neurological manifestations in children, causing neurodevelopmental delays or other issues like autism, ADD, etc. So it's very important that you approach your healthcare professional and get yourself tested for these markers and symptoms to know whether you have celiac disease or not. Functional medicine has a unique approach to autoimmune diseases, especially celiac disease. We see a triad of involvement wherein we look at intestinal permeability, your environmental factors and your genetics, and these three are considered as very important factors which are going to play an important role in the genesis of the disease or even the progression of the disease. For example, if you have an intestinal barrier or mucosa which is intolerant to gluten and peptides similar to gluten, then probably you are going to get symptoms of celiac disease. If you have environmental factors which are supporting the development of the disease, like if you were not breastfed, if your dietary habits involve eating a lot of processed food, lot of sugars and high gluten products, and less of fresh vegetables and fruits, gluten-free grains and fresh foods, homemade, healthier ones, then probably you are more predisposed to developing celiac disease. And if you have, more so if you have genetic predisposition, if you carry a gene which is going to regulate the kind of microbiome or the bacterial colonies you have, or even the intestinal tolerance to different peptides, then probably that's going to determine whether you get celiac disease or not. Because if two individuals eat the same load of gluten, if one has a genetic predisposition, they might react to gluten products in a worse fashion than the other one who has no genetic predisposition. So these are the important factors which probably need to be addressed. And the next question is whether we can change this. We can definitely alter all the three, because your intestinal permeability, your environmental factors are all modifiable risk factors. And in terms of genetics, we have something called epigenetic influences. So by changing the environment around the gene, we can actually modify or manipulate the gene switch on and off mechanisms, and that's going to help us in regulating the disease progression and also reversal. And there might be some things that you need to do for a very long time, but it's definitely treatable. Yes, for celiac disease, if we address the triad of causative factors, then definitely we can manage the disease and reverse the progression of the disease to a very great extent. It involves different modalities. There is no one size fit for all, because the amount of influence each of these factors have can vary from individual to individual. Some might need probiotics, some might just show a lot of improvement with just lifestyle changes or dietary modifications. Some might need some support in terms of gluten degrading enzymes, because it's very difficult to get gluten-free grains or products, because most of these food products are processed in a facility where gluten grains are also processed. So there is a greater chance of contamination. So it's a very diverse topic, and it's very individual based, personalized medicine, and it is very promising when we make a lot of changes in terms of your attitude towards the disease and life, modifications in the diet and nutrition with a lot of supplements, and follow-up testing to see how the disease is progressing, or whether it's getting better or worse, or it's the same. These things will help us in knowing what the root cause is, and will let us modify them, and the patient will feel better. You can get more information from our clinicians, so please visit www.hashtagayur.com or write to us at hashtagayur@gmail.com. You can see the information in the description box below. Kindly subscribe so you will also have access to our new videos which are educative, and you will also know when we have free webinars and health education programs from #ayur every month.